Hi, everybody. This is kind of a nice venue to have this conversation. Basically, what I'm talking about tonight is alcohol in the heart. Is it a good thing, a bad thing, somewhere in between? Good for some people, bad for other people. The question is, does data, are there studies that would suggest that there is some health benefit to modest alcohol consumption? One of the questions is, what is moderate alcohol consumption according to the American Heart Association? Can anyone answer that question? One for men and two for women, okay. And how would we actually find out, where do we come up with this? If you look at the TV, you'll have someone that's talking about coenzyme Q10 and how this is the best form of it. More doctors brag on this than any other preparation. And a little old lady comes on and says, I take this, it's as good as hot bread, and not only is my heart better, but my thinking's better, and so is my sex life. And so how is it that we have found over the years that there might be some health benefit to alcohol? Can anyone answer that question? Well, we do some research, don't we? And one of the original research tools was actually called the Framingham study, which started in 1948. There is a town in Massachusetts called Framingham that has a population, I think, of 40 or 50,000 people. And the universities in the Boston area decided that they were going to take a look at the entire population of that town and start doing demographics of that town and follow these people along to find out what happened to them based on what their blood tests were, what their blood pressures were, what their habits were. And the interesting thing was that they found that patients that drank alcohol moderately actually lived longer than teetotalers or people that drank alcohol too much. And so that was an indication, and this has been really verified in a number of studies that are controlled studies. It's not as if you just take anecdotal information and you say, well, I drink like a fish and so did my father, and he lived to be 95. It's not like that. It's where you actually look at the demographics, you do blood tests on these people, see what their cholesterol is, see what their blood pressure is, and then you follow that population of patients over a number of years to see what happens to them. And what they found was, and what a number of studies have found was, that there seems to be something about modest alcohol consumption that may allow people to live longer. So that's interesting, isn't it? Yes. And so they find that in teetotalers, mortality rates are higher than those consuming 1 or 2 drinks per day. And this is an interesting study that looked not only at the amount of drinks that people were having, less than a drink a week, 1 to 14 drinks a week, greater than 14 drinks a week, but they also looked at physical activity. If you were physically inactive, your mortality rate, the likelihood of dying as a result of heart disease, was higher than if you were more physically active. And so that's why all of us in the room play racquetball at least a day or 2 a week. And Mr. Kamvik is beating me badly these days, but he's 15 years younger than I am, and that makes me feel a little bit better. But this is another indication that there may be some benefit to alcohol, but that benefit may also apply to physical exercise. And in fact, there have been some studies. There was a study of longshoremen in San Francisco. Dr. Paffenbarger looked at longshoremen, and he classified their jobs according to how physically active they were, and they found that longshoremen who had very physically active jobs did better in terms of their longevity and their risk of heart attack than the people that sat behind a desk. So we now certainly suggest that people in this country consider having some physical activity instead of sitting and watching TV all the time. The other thing that's sort of interesting, and it doesn't originate in Framingham, Massachusetts, but it has become fairly well known that in France and Italy there is a lot more fat in their diets, and they're more likely to smoke than Americans are. And for some reason, even despite that, their mortality rates are relatively low in terms of cardiac disease. And so you say, well, I don't know, what is the reason for that? It may be because they really like their wine in that country, and they will have wine with most of their meals, including breakfast. The other thing is that their diets are substantially different than Americans. They have more fish, they have less dairy products and things like that, and they tend to use a lot of olive oil in Europe. And it turns out the country in Europe that uses the most olive oil, anyone care to guess? No, Spain. And so it turns out that olive oil is sort of interesting because it is not polyunsaturated, it is monounsaturated. It has, when you look at the molecule that is considered the active ingredient in olive oil, they find that instead of being polyunsaturated like most of the food that we eat in this country, olive oil has only one unsaturated chain out of the three, and the other two are saturated. And for some reason, that seems to really result in substantial benefit. So if you're going to do anything other than exercise, have modest alcohol consumption, the other thing you should do is go home and start eating olive oil, because it's good for you. So what are the mechanisms for cardiac protection? We find that one of the features of alcohol consumption is that there is a predictable and relatively mild rise in HDL, which is the good cholesterol. That's the scavenger molecule. That's the one that actually goes out and cleans up the blood vessels a little bit. And we find that alcohol will have a modest beneficial effect on HDL. Also, exercise will have a nice effect on HDL. The other thing besides the HDL is that it appears that there are certain chemicals in alcoholic beverages, especially wine, that may act as anticoagulants. And so we know that the average patient with known cardiac disease takes aspirin because of its beneficial effect on clotting. And in fact, if you're at home and you develop chest pain, the first thing you're supposed to do after you call 911 is to pop 4 aspirin, chew 4 aspirin, and that has been shown to be beneficial. So if you have a similar property with the consumption of certain alcoholic beverages, especially wine and especially red wine, then there may be some reason to drink it. Also, there are antioxidants that hang around in especially red wine, and those one of them is resveratrol, which some of you may know as the drug of youth. If you take enough resveratrol, you won't get old. That works especially well for rats who are receiving very high doses of it. But that being said, there is information that there are other compounds that are specific to red wine that may be particularly useful in terms of helping out the heart. So, in answer to one of the questions that's on the quiz there, it says true, false. Does it really matter what alcohol you drink in order to have the benefit of the alcohol? And the answer is no, it doesn't. If you drink beer, if you drink wine, if you drink hard liquor, the benefit in terms of the HDL is very similar. So if you don't happen to have a liking for red wine, or if you flush with it, or you just can't take it, then other forms of alcohol may still have some benefit. Well, let me think. Are there any downsides to alcohol consumption? Well, there's a lot of things, sad to say. And that's why, in all honesty, the American Heart Association to this day does not recommend that a physician tell their patient to start drinking if they're not drinking. They're a little bit afraid that if you turn this patient loose with the demon rum, that, that bad things are going to happen. They're going to, you're going to come to this talk and drink a little too much wine and then go out and smash into somebody. So there are things, there are implications to excessive alcohol consumption, and they're pretty well known in this society, some of them not as well as others. Alcoholic cardiomyopathy is something that we see a lot in the city of Chicago, where there are people that are really heavy-duty alcohol consumers, usually beer or T-Bird or something like that, and some sort of really bad hard liquor. And those patients may come in with very serious problems with a weak heart muscle. And the good news is that in some cases, if they quit drinking, they will actually experience considerable improvement in their heart function. But, sometimes it's a little difficult to get them to quit drinking. Alcoholic liver disease and pancreatitis. Pancreatitis, the pancreas is a digestive organ. It's chock full of things that will digest your body if it gets inflamed. And so if you come into the hospital with alcoholic pancreatitis, you can be a very sick person and you may recover from it, but you may have chronic pancreatitis, and those patients will be in and out of the hospital with belly pain and with problems digesting things, have to take digestive enzymes orally to try to compensate for that. It can be a really serious problem and one that can kill people. There is an association between alcohol consumption and a modest rise in blood pressure. So the doctors who are treating high blood pressure, which is nearly all of us, will, if you have a patient who's really, you can tell when they show up at 2 in the afternoon that they already have alcohol in their breath or something like that, then you may have a conversation with them about whether that's entirely good for them. Also, interestingly enough, there seems to be an increase in the incidence of breast cancer among women who drink considerable amounts of alcohol. And then there are interactions with drugs that are very commonly used in cardiac patients, especially warfarin, which seems to have an interaction with almost everything. And finally, there's the caloric value of alcohol, which can't be underestimated. Those of us who like to have a little alcohol with dinner are not only eating the calories from the food, but they're getting the calories from the alcohol. This is the statement from the Nutrition Committee of the American Heart Association. And what they're saying is that there are about 100,000 excess deaths per year as a result of drinking in this country. But they also recognize that there was health benefit to modest alcohol consumption. And they said, if we told everyone who was drinking to quit drinking, there might be 80,000 deaths that occurred as a result of stopping. And so they have a hard time actually advocating alcohol consumption, but they say, basically they will say, if you're considering it, you should have a conversation with your physician. And if you're already drinking, then just be modest about it and don't go overboard, because that's what's going to hurt you. And this is what they put in there as a disclaimer. They say, we really can't be proponents of drinking, but if you have a conversation with a physician and the physician feels that it is not inappropriate, that they don't say that you shouldn't. This is just a little slide that talks about the things that can happen as a result of heavy drinking, and you just don't want to go there. And obviously, one of the big ones is what happens out in the streets when people get a little bit overserved. This was the cover of the Wine Spectator some years ago, and it was basically saying, and the whole issue had to do with the health benefits of modest alcohol consumption. And of course, they're all in favor of that, being a proponent of wine drinking. Thank you all for coming.